An adult hypertensive male presented with sudden onset severe headache and vomiting. On examination, there is marked neck rigidity and no focal neurological deficit. Symptoms are most likely due to option A, hypertensive intracerebral bleed, option B, subarachnoid hemorrhage, option C, meningitis, option D, ischemic stroke. Mostly the confusion is between hypertensive intracranial bleed and subarachnoid hemorrhage. Let's have a look into both. Subarachnoid hemorrhage has a traumatic etiology as well as a non-traumatic etiology. The most common non-traumatic cause for subarachnoid hemorrhage is aneurysm rupture. Classically, the subarachnoid hemorrhage is presented with a severe headache and it is often referred as a thunderclap headache. Other symptoms which can be seen in the patient are neck rigidity and vomiting. The hallmark feature which is seen in subarachnoid hemorrhage is blood in the CSF. Guys, please tell the exact location of collection of blood in subarachnoid hemorrhage. It is in subarachnoid space, the space between the subarachnoid membrane as well as it is in the subarachnoid space, the space between the subarachnoid membrane and pyometer. So there is no focal neurological deficit in subarachnoid hemorrhage. In hypertensive intracranial bleed, there will be a focal neurological deficit. The most common location for a hypertensive intracranial bleed is in putamen. This is brain, and the first covering of the brain is the pyometer, and the next layer is the subarachnoid membrane, and the final layer is the durameter. The space between the pyometer and the subarachnoid membrane is the subarachnoid space, and the blood is collected in this space in subarachnoid hemorrhage, and there will be no compression on the brain, so no focal neurological deficit. Whereas the bleeding in the hypertensive patients is inside the brain, most commonly in putamen, and that can lead to focal neurological deficit. So guys, what will be the answer for this question? Yeah, you're right. Well done guys. Now let's look into some more points. Unruptured aneurysms produces some symptoms, and from the symptoms we can get a location of the aneurysm. If the patient is complaining about pain behind the eye, most commonly the aneurysm will be in MCA. If the patient have a sixth nerve palsy, most commonly the aneurysm will be in cavernous sinus. If the patient have a third nerve palsy, the most common location of unruptured aneurysm will be in the junction between posterior cerebral artery and internal carotid artery. This is a circle of Willis. This is the middle cerebral artery. This is the internal carotid artery. This is the posterior cerebral artery. If the aneurysm is in middle cerebral artery, the patient will complain about pain behind the eye. If the aneurysm is at the junction between posterior cerebral artery and internal carotid artery, patient will be having third nerve palsy.